You are with the big story with us. I'm Seher Zama. We're making a start and giving you an update as far as the latest numbers are concerned. It is on a worrisome note. Overnight, there has been an increase of about 232 new reported cases. With that, our total tally of total positive cases reported in the country has now gone up to 2,301. The death toll that has gone up to 56 as well. We're getting in breaking inputs here. This is once again regarding the Markaz issue. Health Ministry sources now to Mirror Now claim that the first time that they actually raised an alarm regarding the Markaz event in Delhi was the 19th of March. Information that had been shared with the Delhi government. And here's what the Health Ministry further adds, that the Delhi government was unable to track that there was a huge gathering at Nizamuddin, despite repeatedly being told about it by the centre. All right, so this is an allegation now that's coming from the Health Ministry as against the Delhi government. Remember, this would also mean the role of the Delhi police that should be questioned, which is under the centre. But the central government through the Union Health Ministry has said that the Delhi government was kept in the loop of this, was informed about the Markaz, about this event, raising an alarm with respect to international travellers coming in here on this as well. Our correspondent Ayushman is getting us further details. Ayushman, this is now just the start of a blame game once again between the centre and the Delhi government. Even though the Delhi police that falls under the centre, but as per the Central Health Ministry, the Delhi government was already kept in the loop of this.
Yes, in fact, Sahar, what we are getting to know from the top officials of the health ministry is that on 18th March, when 9 Indonesians tested positive in Telangana, during that time only the health ministry got to know about it, and on 19th, the NCDC shared this information with the Delhi government. And not only that, even the MHA knew about it on the very same day, and on 20th of March, a team of Delhi government visited Nizamuddin Markaz and informed NCDC that no one is there and they have not allowed anyone to visit the site. And at the same time, on 21st and 22nd, in the meanwhile, the number kept rising from Telangana, and all through the contact tracing, the leads were there towards the Markaz only in Hazrat Nizamuddin. Then a team again often visited and said that they have no, the Delhi government team which visited, they said they had no clue of such kind of gathering inside. On 24th March, again 7 people tested positive in Telangana with linkage to Nizamuddin Markaz. Then NCDC formed a group of Public Health Foundation of India volunteers to know about the exact situation of Markaz. And then the PHFI informed them of a huge crowd inside, and then all of that action that you see then started. So definitely everybody was knowing as to what was the situation, because the kind of numbers which we were seeing from Telangana, that was huge, and they were all testing positive, and their tracing led towards Markaz only.
All right, but Ayushman, at what point in the midst of this blame game now between the centre and the Delhi government, at what point should one be questioning the Delhi police here on this, falling under the central government?
Yes, like we have been questioning the police as to how, when we already had witnessed the lockdown orders, there were already a restriction of people gathering at the Delhi Chief Minister had already been saying this during his speeches that not more than 20 people will be allowed to gather, not more than 5 people will be allowed to gather. There was Section 144. So all of this definitely has to be implemented by the Delhi police on the ground level. What was the police doing in that area? Those kind of questions are there. But definitely what we are getting to know from the health ministry is that the information was duly shared with the Delhi government and, of course, with the MHA, and all of these officials were in know of the development of what was happening. But definitely they never apprehended such kind of gathering being there in the Markaz. And when they got to know about it, the evacuation was done, then the contact tracing was done, then positive cases came to light. And right now, you see, yesterday only, over 141 cases came positive and over 129 were there from Markaz. And the total number of positive cases in national capital only stands at 293. And currently, if you talk about the country, we are at over 2,300 positive cases in the country right now.
Yes. Ayushman, thank you for getting us those details. Yeah, this is just the start of an ugly blame game, but important to note, if there was information with the central government, with the Delhi government, with the Delhi police, could they have acted in on time? Delhi police has now stepped up as far as investigations here on this incident here is concerned, with the Delhi police crime branch now handling this case. A 26-point query notice that has now been sent to the Markaz chief. Remember, while he is underground, but he's clarified that he's not absconding, he's on self-quarantine. But this is the set of questionnaire being sent to him across the board of 26 points being raised to Maulana Saad. In Delhi, the Delhi police having asked the cleric to furnish details of the list of employees, the list of attendees, and if permissions were taken and CCTV visuals of the event. So the Delhi police, of course, now wants to scrutinize CCTV footage of this as well. Our correspondent Alok is getting us further details here on this. Alok, in that 26-point questionnaire here, one would think a lot of which with the Delhi police should have already known, especially with respect to permission sought or permission taken or permission denied.
Well, absolutely. In fact, the Delhi police knew about what all was happening inside the premises, and because we showed to our viewers that the police.
Okay, we'll have to reconnect with Alok on that in just a bit. But remember, this is now going to be massive investigations. It could become pan-India as well, in seeking help from other state polices as well, because positive cases connected to the attendees that have been reported in other states as well. But remember, a couple of days following the massive numbers that have come in from those, the attendees who were part of this meet, now questions being asked with respect to what the authorities were up to in this intermediate time. As our correspondent Alok has been getting us those details here. Alok, while the Delhi Police Crime Branch is pressing on with those investigations, and rightfully so, a lot needs to be taken into account of how much the Delhi police here should have already known, should have acted upon well in time.
Well, definitely. But what we can say that this is the procedural thing that the Delhi Police Crime Branch is doing. Although they knew about the fact that the local police knew whole congregation is going on. And in fact, the local police also appealed to the people, those who were there, the appeal to the authorities as well. And they were very much known about the fact that this kind of gathering is happening because it happens for 365 days. And if you see that particular area, that local police station is located just a few steps away from that particular building, that Markaz building. So definitely the local police knew about the fact, and in fact they were giving the information to the MHA and also the top officials. Despite that, this kind of people were gathered there, and in fact during the time of the lockdown, the gathering were remained there, and this is why the Markaz chief, because the police had registered a case under various section of IPCs and also under section 3 of the pandemic disease, and therefore now they have sent the questionnaire to the main Markaz chief, who is Maulana Saad, and he has to reply in the written form. This is very interesting also because he is in the quarantine, so Delhi police has not asked him to come before the team, but they have sent the questionnaire of 26 points. That's and right. In fact, in these questionnaire, very interesting points that I just want to highlight is that one is that police has also asked about the bank details of the Markaz. That is very important because police wants to know about the fundings of whole Markaz. That is also very important. The second point is very interesting, that they have accessed the details. They have sought the details of the CCTVs, how many CCTVs were working. In fact, in the questionnaire, they have also asked that whether they were following the lockdown orders or not, what kind of videos they were sending, what kind of speeches they were delivered inside the Markaz. All these things have been sought. So definitely, Delhi police is going deeper into the investigation, although they cannot do much about as of of now, because all the accused, because 7 persons are accused in this person, all are in quarantine, apart from, and they cannot go to them to arrest them. But as of now, they have sent the notices and they have asked the reply in the written form.
All right, Alok, many thanks for getting us all of those details. This is a 26-point questionnaire being sent out to the accused in this case. With that, we're slipping into a breather. Stay on with us on The Big Story. Thanks for staying on. We're looking at a third positive case that has been reported from Dharavi. A 35-year-old doctor who has a clinic on the main road in the Dharavi area of Mumbai has also tested positive here. This is, of course, coming in on a very worrisome note. Remember, because Dharavi is a very congested cluster, is what we're looking at. The patient who has no travel history. The Mumbai civic body, in fact, has stated on this that the coronavirus patient has now been admitted to the city's hospital here, the Raheja hospital, currently undergoing treatment, and till no one will be allowed to enter or exit the building, with 25 high-risk contacts in the society that have been tested. Remember, this is an ongoing procedure here, contact tracing of the doctor, which is currently on as well. 3 coronavirus cases now that have been reported from the Dharavi area itself. The civic body, the BMC, has now sealed off buildings. Remember, each time there is a case reported from an area, that becomes a hotspot, and then following which the area is sealed. Sanitization process that takes place and continues for a few hours, and this is to ensure that the virus is contained in the area itself. It is sealed, it is then sanitized and disinfected, and no one's allowed to step out. To the extent no one would be allowed to step out for essentials and foods as well. And the BMC then gives in an assurance that food delivery would be provided to the people staying there. They will not be stepping out. We'll get you more details here concerning this third case that has been reported. It's important to note here on how the history of this case is going to be dealt with by the authorities, because remember, this is a person, a doctor, who has reported positive as the third case from Dharavi. He has no travel history. Contact tracing is on with respect to his own clinic and the other patients who had visited his clinic, his locality and other areas that he'd been to, and the other people who visited this clinic at the time of the 14-day period here till the time he started showing these symptoms. This is a 35-year-old doctor. He's now been taken across and further admitted to the Raheja hospital, where further administration and treatment is on. This is the third case from the world's largest slum cluster that we look at, Dharavi, shots of which, file shots of which that we are playing out in your screens to give you an idea the kind of area that we're looking at, the congestion in this area, wherein which social distancing becomes practically impossible because the circumstances under which people are living, staying and functioning in this area. And with this third case reported, once again, it has been decided by the BMC here to seal off buildings and shops which were in contact of this person and also in contact with the deceased as well. Remember, the first case reported from Dharavi is a fatality. The person unfortunately succumbed to the coronavirus. Our correspondent Disha is getting us further details here on this. Disha, as far as containment efforts here are concerned, what are we looking at right now, please?
Definitely, as far as Dharavi is concerned, Seher, you rightly pointed out, it's the third case here, and specifically in the last 72 hours, we have seen all these three cases here in concern. So if you talk about the latest case about the 35-year-old surgeon, he's been admitted at the Raheja hospital. In fact, he stays at the main road in Dharavi area where there are approximately 48 flats, which essentially means there are about 300 people staying in that entire building. And that building has now been sealed by the BMC, which essentially means they are stamped, they are quarantined, they are not supposed to leave the building premises till the time all tests are not done. So that is one. Secondly, in terms of containment areas, Dharavi, of course, it's very huge. It's spread across 600 acres. And out of 600 acres, what we understand, Seher, that at least roughly about 9 buildings are being sealed at this point in time because we have seen 3 cases in the last 72 hours. So most of these cases where these patients have been found positive, those buildings have been sealed is what we understand. The shops surrounding these positive patients where they used to work, those have been sealed. For instance, in this particular case, there were 3 nursing homes inside the building that the patient lives. So that, of course, has been sealed as we speak. So these are certain containment measures that we are talking about. In fact, BMC says that nobody's allowed to even step out till the time the high-risk patient tests are not done. And they are saying that there are about 25 high-risk patients in that entire building as per the initial investigation. So these are certain measures that the BMC is taking on the ground level, Seher.
All right. Okay. All right, Disha, these are of course going to be very difficult times here, but undoubtedly all of these measures that need to be respected and taken along with patience for people living there. Disha, thank you for getting us those inputs. And continuing with inputs here coming in from Maharashtra, remember the state which has the largest number of cases reported and with cases in Mumbai that are seeing a rise as well. As Disha was explaining, containment measures that have to be taken in hotspots that have been identified. So according to the BMC here, talking only about Mumbai here, 212 containment zones have been identified. These are areas where people have been advised not to step out of their buildings because of positive cases that have been found there. What is worst hit in this process are hospitals because doctors who have reported positive where treatment for coronavirus has been going on as well. So there are containment measures taking place in some of these hospitals as well, which have been affected as far as functioning is concerned as well. Our correspondent Santya getting us those inputs.
One by one, for example, if we talk about WOCKHARDT hospital, that's that place where one asymptomatic patient came and when he showed other symptoms, at that time when his testing was done, he was found positive. At that time, all those staffers, medical staff, nurses and doctors and other staff of the hospital who came in touch with the patient were of course quarantined. And after that, the whole hospital was contained. So the current situation of the hospital is that how nobody can, of course, come outside of the hospital. They are not taking new admissions. On the same lines, similar is the situation with SAIFEE because when one doctor who went there, who was part of the hospital, who went there for a checkup, at that time also nobody realized initially that how he was positive with coronavirus. It was only his detailed reports showed. So that also was a reason that SAIFEE was also, some part of SAIFEE was sealed in the beginning and then the whole hospital was sanitized. Now BMC has given some more days to SAIFEE to get the sanitation process completed. So in SAIFEE also no new admissions are happening. Now if we talk about state-run hospitals as well here, government-run hospitals here as well, Apurva, there is one such hospital in Kandivli area of Mumbai, that is SHATABDI hospital, where I am right now. Now as far as SHATABDI hospital is concerned, here no sealing has happened per se, but there was one asymptomatic patient who came, and it was only after further test results the hospital realized that he was actually positive. As a result, 40 staff members of the hospital had to be quarantined. As far as Shatabdi is concerned, of course, no part is sealed. The other operations of the hospitals are absolutely on, but 40 staff members had to be quarantined. These are some of the examples, Apurva. Now this includes JASLOK hospital as well. WOCKHARDT, I told you. Sai hospital, there's this one private hospital in Mumbai's Chembur area where initially there was one again asymptomatic patient, but the hospital did not even inform BMC properly after that, and it was not contained after that, which actually led to admission of further people, where a 3-day-old baby was initially believed to be positive, because that was the private lab test report, that's what said. But after that, when the government labs test report came, it showed that how he was tested negative. So that hospital is sealed since 31st of March. So these are some of the hospitals where either the hospital staff got hit or the hospitals got sealed or contained.
Also, at a time when protective gear and masks and availability is most required in the country today, TikTok has stepped forward. A very popular social media platform with a very large following. TikTok giant there has donated 100 crores towards medical equipment in India. In fact, they've given out details of this as well, donating 4 lakh hazmat medical protective suits and 2 lakh masks to protect doctors and frontline workers. A statement here that has come in from TikTok as well. Let's read out that official statement, saying that while citizens are practicing social distancing, staying at home, India's medical personnel are working tirelessly to keep all of us safe, and as a result, our medical doctors, health practitioners, workers become the frontline warriors here for battling coronavirus. Additionally, our contribution there is also going to cover local, state-level medical workers, as we have donated 2 lakh masks both to the Delhi as well as the Maharashtra government.
India is at a crucial juncture in the fight against coronavirus, but some of our frontline warriors are finding themselves handicapped.
डॉक्टर्स को काफ़ी दिक्कतों का सामना करना पड़ रहा है। सबसे ज़्यादा दिक्कतें अभी इस टाइम पे आ रही है पर्सनल प्रोटेक्टिव इक्विपमेंट्स की, जैसे मास्क हो गया, गाउन्स हो गए, आगे शॉर्टेज पड़ने वाली है, तो गवर्नमेंट को श्योर करना चाहिए कि इनकी सप्लाई कंटिन्यूसली होती रहे।
काफ़ी जगह से कॉल आ रहा है, डॉक्टर्स, पैरामेडिक्स, नर्सेस एंड सिक्योरिटी पर्सनल को प्रॉपर पर्सनल प्रोटेक्टिव इक्विपमेंट्स नहीं मिल रहा है।
Taking note of their plight, popular social networking app TikTok has donated medical equipment worth 100 crore to strengthen India's fight against coronavirus. The supply includes 400,000 hazmat medical protective suits and 200,000 masks to protect doctors and frontline medical staff.
I believe we all can come together for this great cause, and TikTok India is doing a lot at front. I think it's a matter of great pride and great honor that we are as TikTok India family and the family to serve the personal protective equipment, essential gear to the doctors and frontline health workers.
At times like these, the safety of our healthcare workers is of utmost priority. After all, they are the heroes at the forefront of this war. Bureau Report, Times Now.